me pull up an image so it's easier to. So when we talk about the anatomy, down there in the women parts, you have the initially you have the uterus, right? Then this goes to the ovaries on either side. Over time, this part and this part just becomes atrophied, and as we age, we don't need the ovary anymore, so it dies down gradually and goes away.
All right.
Or it becomes so small that we can't even see it. That's okay. That's normal after we become menopausal, because you don't have the hormones, you don't have eggs in there, so you don't need them anymore.
All right.
So this is the uterus part. From the uterus part, when it comes out here, you have an opening here that looks like this, an opening.
For
and the baby and all goes in here, and it goes. And same way, inside the uterus, you have a lining that goes like this. If I take a piece of it and look at the lining there, you have the actual outer layer kind of deal. This is the cartoon version, easiest to remember. Then you have a muscle. Then you have an inner layer. The inner layer is in multiple layers too, but we call it the inner layer. Its inner layer is the endometrium. And the endometrium part, this is the part whenever you have a period, it sloughs off and goes out, and you make a new layer. It sounds pretty brutal to think like that, but that's what a period is. Every time it sloughs it off, and you get clean layers again, ready for the next egg. That's the whole point of it. But if an egg comes in and fertilizes, then the endometrial part doesn't slough off. It starts getting thicker and forming everything else to get a baby to be around in it. So that's the normal process. But the thing is, when this part, every time it sloughs up and makes up in women and all, there's a chance, like every time you remake something mistake can happen. That's a mistake that happens, causes the cells to be different. Usually, in even the skin, remember your whole skin sloughs off every couple of weeks or so. But when it is sloughs off and we make a new one, and I'm sorry, before that, the reason it sloughs off is every cell in your body has a limited time limit. Because there's a tail end that gets shorter, and when it's done, it dies out. Every single body. But if something happens and the tail end is not getting shorter, now you have a cell that keep on repeating itself over and over and over, making it. That's a cancer cell. There are certain parts of our body that can do it without becoming cancer. But cancer cell means a cell that do not stop growing. It keeps on growing over and over and over. There's no stop time limit. There's no time frame that it will die out. So in the endometrium, when they were looking at it, and the endometrial, initially they saw an area that was a little thickened here in one of the areas in the ultrasound. So they're like, it's thickened, and it by the ultrasound level, it looks like there's something in there under that. We think it may be an IUD. That's why from the ultrasound, when they looked at first from this side, then from the inside, they're like, it looks like most likely an IUD, but there's a thickening or there's changes in the wave that goes through that shows something is there. We don't know what it is. So they were trying to figure out initially at this level here. I don't know where exactly your one is, but I'm just guessing. Okay, we're just talking about the level here, not talking about the actual anatomy. So the endometrium, this thin one, we're saying, okay, there's something here that seems to go into the muscle a little bit here. There's something there. We don't know what it is. So they went back and they did the. So in the note they said that they went and did initially the pap smear that was normal, speculum looking, nothing. They did not see any IUD or anything. then did the ultrasound of it, the initial one simple one, and said, oh, something is wrong. That's when they send you to the full ultrasound where they did inside and outside together. And that's the one that says, okay, mostly unremarkable, but in the structure related in the wall of the uterine fundus. We don't know what it is, but something looks it to be there. Then you went and did the MRI. MRI said, well, it could be an IUD or it could be something else that is making that area a little thicker. We don't know what it is by looking at the MRI even, because it's not a definitive IUD looking. But it could be or could not be. So they said you need to go for actual hysteroscopy where somebody actually goes in there, scrape. When they went in and tried to scrape it out, they didn't really see an IUD-like thing. But they saw this area that was thickened, Oh, and there's nothing for them to take out from there, but it's a lot of tissue in there. So they went in and took a whole bunch of biopsies from that area, as deep as they can go. And then the biopsy came back and said, no, it looks like moderately differentiated cancer cells rather than the regular epithelium. Remember I said it keeps on regrowing? So these cells do not look like the regular cells. This looks like one of those cells do not die out and keep on doing it. That's what they think. The thing is, and also it looks like it may be going into the muscle part, the muscularis part a little bit. So that's the part that they're now, when we see this, now we send you to the gynecology. The CT abdomen, and the main purpose of it is, is there anything beyond that area? Then the repeat transvaginal ultrasound just to see if it is. They may repeat the MR again since we don't. If we can get the image, then we don't have to.
All right.
As soon as you get the MR, I'll have my radiology review it and all of it too, because we don't want to take somebody else's word for it. The thing is, you want oncologists to look at it rather than the regular. So once you see them, then they're going to look to see, is there anything outside of the uterus we can see? If they don't see anything outside of the uterus then the best option is hysterectomy. Just take all the cells out. You're not trying to get pregnant anymore. You're not worried about any. Why go through this? And so just have a complete hysterectomy. A complete hysterectomy, even though, let's see, in our body, this is the vagina part. Okay? Then you have the lips outside your body, and then this is it. When they do a complete hysterectomy, they go in and cut off here. So this whole thing is taken out of your body. But the thing is, right now, it's not doing any use to you anyway. Usually we try not to do hysterectomy unless necessary, is because when we do that, it loosens up the bladder and everything. Then you have a little urinary leak and stuff like that. Those are it doesn't always happen, but it's a chance. So if we don't have to do surgery, we say don't do it. But now at this point, taking it out is more beneficial than trying to save it, because it's not of any use to us.
You're right.
So most likely when you see them, they're going to say, no, we will do a complete hysterectomy, and when they go in, they'll check on everything else and make sure there's no other concerning areas or anything else, and then they will evaluate you and see what's the next step. Do I need to do any other treatment beyond the hysterectomy or not? That's a disease where the chemo, radiation, and all of those kind of deal is something that the gynecology will decide. My hope is, inshallah, that all you have is inside there, that nothing is outside. Once you do the hysterectomy, then we're done. That's the hope. But sometimes, I'm going to be honest with you, our oncology team is much more aggressive. The goal is do whatever you can right now that it never comes back again. You already know about that with this. So that's the goal, and they're going to talk to you about risk benefit of all the different options you have and all. But they'll go more into detail when you see them on the 25th. The other thing is, as soon as if you can get the MR images, as soon as the ultrasound and the CT is done, you can go and be what's called a checker. Meaning that a couple of my patients, because of the weather change and all, they missed flights and all. I have a bunch of international patients, a whole team of them who couldn't make it here. So you're lucky. So like if you have free time, just go to that area. I'll tell you where to go and say, hey, my appointment is on the 25th. I'm here. I've done all my testing. Do you have any cancellations last minute that you can squeeze me in? Nobody in Mayo will get mad at you for asking that. So start getting things done faster. No harm in it.
Good.
Okay?